Hello, this is Jeanette again with more myofascial release. This time for the area of the ear and the temporal bone of the cranium. Three things will take about 15 minutes. So the first one, you put your elbows next to you and your fingers go into your ear just a little bit, and you are pressing down into the opening of the ear, not into the head. So I'm going to start my timer, 5 minutes, and here we go. The elbows are on the floor, so you don't have to work to keep your arms in any kind of position. Your fingers are casually into the ear opening, and it is remarkable how much you feel just by putting your fingers there. And so then you add a little bit of pressure, and you can have that be towards the floor or also a little bit towards your feet, or even towards the floor and a little bit up towards the top of your head. Let that come kind of spontaneously and naturally from within your body, if you can. Close your eyes so that there is less distraction from your vision, so you can focus better on the sensations that you have in your fingers, in your hands, in your head, in your body in general. And then if your head wants to change position a bit spontaneously, you let it. That's just your inner wisdom getting you to do it more beneficial for your body. Your body knows itself inside and out, literally, and knows how to correct. So focus on feeling, not on figuring out or analyzing. Take a deep breath. Making a little sound with your breath can help with releasing. Now, this is also, of course, very close to your jaw joint, or TMJ, temporomandibular joint. In other words, the joint between your two temporal bones in your skull and your one jaw. So the one jaw connects into each side of the head. That makes it important for being balanced, because if it's not, then there will be something asymmetrical going on there in the head. So if you find that your mouth wants to open a bit, allow that. And in fact, if you open and close your mouth, you will feel the jaw bone, the ends of it that go into a joint, you'll feel them move under your fingers. And the whole time you're still just casually applying a bit of pressure towards the floor, or on an angle towards the floor and towards your feet, or towards the floor and towards the top of your head, whichever seems to be right for you. Absolutely no hard effort. It takes very little, to make quite a impact release-wise on this area. It is definitely a technique that you want to repeat. See if you feel anything sort of going on in your head or your chest or your neck. If your jaw starts trembling, let it do that. Relax your face, your forehead. Oh, wow. That 5 minutes went by fast. Okay, now we're going to do behind the ears. So that's on the mastoid process, which is also on the temporal bone. So you're going to contact that with your fingers. This time your elbows go on your thorax, on your chest, rib cage. And so your fingers are now behind your ear on that protrusion on top of it. You won't be able to put your entire finger on there. Do the best you can. I'm going to start that 5-minute timer again. And now you have your fingers again pressing into the temporal bone, which is kind of like right here on the sides of your head. And just have this notion that, of course, your skull is best off if things are sort of in their optimal places and balanced. In this case, in a left-right type of manner, or from the middle to the outside. Anyway, let's not think about that anymore. Let's go back into feeling again and believe what you feel. John Barnes tells us that sometimes in seminars. Monitor your sensations in your entire body. If you have been hurt in your head, which many people have in some way or another, some people a lot, and see how things come up. Any little adjustments of movement in your head and neck, let them happen. And then just relax your face, relax your forehead. Take a deep breath. Relax your eyes. Your eyes have quite a set of little muscles, so there really is such a thing as relaxing your eyes. Relax your cheeks and your jaw. And your belly. Be curious. What can this do for my body? Just think in terms of, I am offering a small force into my body, and my body can do something with that. And I'm not going to be cognitively determining what that is. My body will figure it out. The more of this type of practice you do, the better that will happen. And again, this one too is a technique that needs repetition. This is also a good one to do if you have issues with your TMJ. Or if you have headaches or something like that. If you need to re-grip because your finger sort of drifted, then that's fine. I just did. And if you find that you're getting tired from the pressing, then you've probably been pressing too hard. So just lighten up. It'll still work. Oh, I apologize. That was not the timer. Deep breath. Something to remember for during self-treatment. Turn that phone quiet. That's the timer. And now we're going to switch to ear pull. So this time, elbows again on by your side, and now you're pulling on your ear on the outside with the finger close to the opening but not in it, and the thumb close to the head on the other side. You can pull out and down and just sort of relax your hands, and the weight of your hands will pull down enough. If you feel the urge to pull up towards the top of your head, do that. If you feel the urge to pull down, do that. The timer is already going. So now we are coming at it from a little bit more peripheral. That means farther away from the center of the body. And we're sort of adding to the two techniques that we have already done. So this is called ear pull. It is ever so nice when a therapist or, well, another person does this for you. But it's also nice to do yourself. Just use the gravity of your hands and forearms, and really the effort is only in hanging on to the ears. That's about it. And then give permission. Give permission for this to pull into your head. Imagine that you have floss in your hands from one ear to the other, and I like to think of it as flossing the brain. That gets me to feel deep inside. Relax your whole body. Let go. Such a nice way to get to a calm state where the nervous system is in its normal operation, not fight or flight. In that state, your immune system is likely to work well, along with all the other things like digestion. If you feel stressed, you can use a few myofascial releases to get yourself out of that state. A few deep breaths can also be very powerful. Just anywhere, anytime, especially before things really get out of hand in terms of your tension. Notice if your pull has changed a little bit. I'm pulling a little bit more also up towards my head now, in addition to down towards the floor and a little tiny bit out. It feels really good. I'm feeling my low back relax. Going more towards the floor. My neck is lengthening. Feels so good. Oh, and now my ear on the right side is getting warm. And the left one too. Oh. I think I could use that longer than that. In any case, that was it for this little session. Good luck.